Good afternoon, friends. Yet another Facebook Live session we have today with Dr. Kushal Nag. He's from Apollo Gleneagles Hospitals, Kolkata. Today's topic: what is plantar fasciitis or heel pain? Sir, if you could take this discussion forward.
Yeah, thank you so much, and welcome to the Facebook Live from Apollo Gleneagles Hospital. I'm Dr. Kushal Nag. I am a consultant orthopedic surgeon, and my specialty is foot and ankle. So we run the foot clinic here at Apollo Gleneagles Hospital, Kolkata, and today we are here to talk about plantar fasciitis or heel pain.
Right. So we will be having a lot of questions on Facebook as well, and people have mailed us a few questions for you to answer. So let's take this forward.
Yeah, sure.
The first question, as is the topic, what is plantar fasciitis or heel pain?
Yeah, so plantar fasciitis is a rather fancy term, and I'm sure a lot of you guys are not very familiar with this. But let me dumb it down. Plantar fasciitis is nothing but heel pain, the common heel pain that almost all of us would have faced at least once in our lifetime. It's the most common foot problem that we face in our daily practice. So it's basically pain on the undersurface of the heel, and that pain is the most prominent pain when you get up in the morning and you take the first few steps.
Right. The first question that has come on Facebook as well, people are taking interest. How to choose the right shoe?
Yeah, so we'll come to that. We'll just go down the methodology of how to diagnose and how to treat, and I'll answer the question in the few minutes
Right.
to come.
So, sir, could you elaborate on the symptoms a bit?
Yeah, so the symptoms are very pathognomonic. Like you'll have pain on the undersurface, and you'll hobble along for the first few steps, and generally then the pain reduces a bit. The other way you can see it is that if you're sitting down for a long time, walking on the laptop or watching a movie, or and then you suddenly get up and start walking, and you will limp for the first few steps. So it's typically a sharp stabbing pain on the undersurface of the heel, which reduces over a period of time as you take a few more steps.
Right. And what are the treatment options for?
Yeah, so good question. Plantar fasciitis is one of the few conditions where the treatment is almost entirely conservative. By conservative, I mean non-surgical. There are rare instances where we do surgery to relieve patients from plantar fasciitis, but that's only a very small footnote in the treatment protocol.
What do you mean by conservative option?
Yeah, so if you want to elaborate on the conservative option, ways by which we treat plantar fasciitis, and the most important way of treating it is stretching. So people with plantar fasciitis usually have a very tight plantar fascia. A plantar fascia is a tight band of tissue on the undersurface of your heel. If you hyperextend your toes and palpate or feel the sole of your feet, you will make out a tight band of tissue on the undersurface of your heel. That's the plantar fascia. So we stress on stretching out the plantar fascia and also the calf muscles of your affected leg. And along with that, we also give you certain symptomatic management like icing on the painful part of the foot, wearing custom orthotics, which I will elaborate in a few minutes time. And a combination of these two will eventually make sure that you get rid of this nagging pain in your feet.
Right. So, is there a surgical option as well?
Yeah, there is. Yeah, in a very, very, very minuscule proportion of patients who do not benefit with conservative management, we do small surgeries. By surgery, I mean a release of the tight plantar fascia. But don't worry, 1 out of 100 people will probably deserve a surgery. 99 out of 100 will get better with a non-surgical methods of treatment.
So, in other words, what are the success rates of conservative options, or in other words, how frequently is surgery needed?
So that's what we said, right? So 99% of the time, surgery will not be needed. In 1% of time, you will need surgeries, but that's a very, very rare surgery that we do.
So, you spoke about a custom orthotics. What is that?
Yeah, so this goes back to the earlier question that was asked of us, what type of shoe wear, right? So it's not about your shoe, it's mostly about the footbed or the insole on which your foot rests. So what we do in cases of plantar fasciitis, we prescribe custom orthotics with a deep heel cup. So what it does, it holds the foot by the periphery of your heel. It doesn't have a flat surface, so that there is the point tenderness which you feel on the undersurface of heel is not there. So you put that custom orthotic in any closed shoe that you want. It could be a sneaker, it could be a formal shoe, And hey, if you are a homemaker sitting at home, we can also do it in a chappal or a sneaker or a shoe that you wear at home. So that's what we mean by custom orthotic.
What type of stretches do you recommend?
Yeah, so there are two basic type of stretches, and it's very common for people who have plantar fasciitis. They very commonly also have calf tightness. So we do stretches for two major structures. One is the plantar fascia, where you hyperextend the toes of your affected leg with one hand, and with the thumb of your other hand you stretch out the plantar fascia on the plantar aspect of your sole. On the other side, you have the tight calf muscle. You stretch out your calf muscle by doing calf stretches, which is, you stand on the edge of the stairs, hold on to the railing, go down, go up, go down, go up, and that's how you stretch your calf muscles.
A question that we have from one of our viewers here. What is the care that needs to be taken to avoid the recurrence of plantar fasciitis, and do we have to suffer throughout our life?
Yeah, very good question, by the way. So, that it comes down to the moot point. If somebody asks me, why do I have plantar fasciitis, right? So if you want a scientific answer, the reason why you have plantar fasciitis is because you have a tight plantar fascia, and a lot of these tight plantar fascia is associated with some other foot deformities like a flat foot or a high arched feet and stuff like that. And no, you don't have to suffer for the rest of your life if you do the stretches and you use your custom orthotics. Is eminently curable. In a period of say 2 to 3 months, your pain will start going down, and by 4 or 5, max 6 months, your pain will be gone. And once it's gone, it's gone. It doesn't come back.
So, in other words, what is the timeline of the treatment process? And as you said, it's around 5 to 6 months that someone can be pain-free.
Yeah. So absolutely right. So the timeline is from 3 to 6 months, depending on how tight your plantar fascia is. But the most important part of the protocol is compliance of the patient. I mean, it's easy to take medicines, right? If you heal. So in the X-ray report, it's also reported that you have a calcaneal spur. It is nothing but a calcification at the insertion of the plantar fascia, which looks like a bony projection, but there's no bone there. If you had to go and do a macroscopic study of what's there, it's basically a calcified plantar fascia. So that's why we call it a calcaneal spur, but it's the same condition.
With someone with plantar fasciitis, can they walk barefoot as they have to, especially when they go to temples or other places where shoes aren't allowed?
So there's no restriction on